vaccine distribution process. You announced Long Beach's plan yesterday. Now the breaking news, Pfizer vaccine has been approved by the FDA. Your reaction to that and sort of walk people through how it's going to work in Long Beach in terms of the plan.
Yeah, I mean, we have a really great plan, I think, in Long Beach, and like Pasadena, who's a really great partner of ours as well. We've rolled out our plan. So we have just under 4,000 of the Pfizer vaccine coming into Long Beach here in the next week, a little over a week. And then at the end of the year, early January, we have a little over 11,000 of the Moderna vaccines coming in. So the news, obviously, today is really great and really heartening to hear. We really believe that now we're on a phase where we can really bring, hopefully, hope back to this fight. We are going to defeat COVID-19 this next year, and every vaccination that's in place is going to be really helpful to that. Of course, our plan, we have essentially two major phases. The first phase, we have Group A, B, and C in that phase. And as you can imagine, we begin in Group A with all of our healthcare workers, our hospital workers, nursing homes, EMTs, paramedics. Then you move on to our essential workers in that second group, which is Group B, which includes our teachers in our schools, includes transit workers, grocery workers. And then in Group C, in that category, is going to also include seniors over 65 and folks with high risk categories. All of those folks, of course, the medical folks will be early, and then we'll continue moving on from the spring and get more people.
And Mayor, thank you for approaching this with such positivity, because this is great news. And I think the public at large can take a big, deep breath and look forward to the success. I know in Pasadena, we are almost identical, it sounds like, to what Long Beach is doing. There's a piece of the whole rollout that I had a question about. I'm apparently on track to get this thing the first week of January, but I was told I have to schedule it through the state. Why is the state involved with this?
Okay, so it really depends on your place of work and the different kind of mechanisms. So in some cases, the state is going to be involved in doing the direct vaccinations. For example, we have a pharmacy program where pharmacies are working with the state to do vaccination at certain nursing homes and certain facilities. In other cases, the city will be directly involved with the workplace and give the vaccine out. And in other cases, hospitals directly will be giving out the vaccine. So we're still working out those kinks on the back end, but there'll be different distribution models on how the vaccine gets out. The important thing right now is to ensure that cities and counties have the refrigeration and the infrastructure in place. So we have it in place in Long Beach. Pasadena is all in good shape as well with the infrastructure. So we're feeling good about getting it out. But it's not a perfect system. We're learning as we go. So there's going to be a lot of adjusting to go along the way.
In the meantime, though, it's still going to be a while before most people get this. It could be midsummer before sort of everybody has the opportunity to get this vaccine. And the numbers, the case numbers now we are seeing are quite overwhelming for certain healthcare providers. We know, of course, your mom, your stepdad both died due to COVID-19. You've been a big supporter of some of the restrictions that have been added, including the restrictions on outdoor dining. There are some that say, where's the evidence for that? Is that really necessary? What do you say to some of those critics?
Well, first to the critics, and especially to the small business owners and the workers, I say, I get it. Like, it's awful. To close anyone's business is terrible, and people are suffering. They're unemployed. It's their livelihood and their families. And so all the restaurant owners that I talk to, I understand why people are mad and upset. So that I get. Same time, I've been very supportive of the decisions made by our public health officials. And I'm not a public health officer. I didn't go to medical school, but I listened to the work that they're doing. And so for them, that issue in particular has really been one about masking, about ensuring that folks that were limiting activity, their folks are not masked. And so I understand that. I certainly think it was a very, very painful. But I also look at where we are today with the numbers. I mean, we have across this country right now, 9/11 level death events happening every single day. In Long Beach, we're almost at 300 of our neighbors that have lost their lives. And our hospital system now, and our ICU capacity is at 7 or 6% across the whole Southern California region. So we're in really bad shape, and it behooves us as much as we can to separate, especially as Christmas is coming up. Stay home with your loved ones. I had a pretty sad Thanksgiving, but I was alone and tried to do the right thing, and that's what most folks need to do.
To the point, though, another thing I know you've been very vocal on is that you need more help from the federal government. I spoke with Congressman Adam Schiff for our political show. The issue is tonight at 10:30. Try to get an update on where the talks are at. Here's some of what he had to say.
A number of Republicans and Democrats got together and hammered out a deal that would provide a lot less aid than I would like to see, but nonetheless a sound compromise. I support it. The Democratic leadership in the House supports it. But Mitch McConnell threw cold water on that yesterday for reasons that are difficult to understand given the precedent.
What is your message tonight to Congress? What specifically do you need that money for?
Well, the congressman is right, and it's unbelievable that Congress is sitting, doing a bunch of other things, or about to go home on a Christmas recess, and have not yet passed stimulus for cities and for states. We need that money desperately to continue our testing centers, to support the vaccination process. Our hospitals need that support, and cities need the support also to support clinics with PPE and other issues. So it's unbelievable to me that you have a bipartisan package, Republicans and Democrats agreeing on a bill, which I agree, I wish was a lot larger, and they can't even get that passed because you have one person in the Senate that's blocking it moving forward. It's unbelievable. I mean, I don't think people understand the need that we have in our local governments, and to get that money out also to workers.
Dr. Drew.
My understanding is the holdup is an attempt to reduce the liability of small businesses against COVID lawsuits. It's a shame that would hold this whole thing up, but it's also a shame if small businesses that are barely going to survive this thing, are they going to be subject to lawsuits down the road?
No, and I understand that, actually. So I think all the mayors have had this conversation. We obviously want to make sure that small businesses are protected, but also you got to make sure that workers have the ability and have rights to be safe. And so why they can't compromise on that issue, you certainly have both Republicans and Democrats in agreement on 99% of the package. And so to just dismiss it and say we're not going to do anything, I think is unacceptable. They should figure it out, and they shouldn't go to Christmas break until they have a bill passed and the president signs it.
A bit lighter note here. One of the things we like to talk about here every night is trying to stay healthy. And physically healthy is how you beat this virus as well. I saw that Axios, the journalism company, is doing a big thing next week with you about staying healthy during the pandemic. I'm wondering, sort of, what is your message to that, to people on that front?
I think health and fitness is really important. One of the things that during this current shutdown, the state is obviously encouraging outdoor fitness and outdoor fitness classes, which I think is really smart to do in a way that's safe. I try to personally stay healthy as best I can. I actually have a personal trainer that does classes through Zoom and as safe as possible. But mental health is also really important right now. We've got to take care of each other, go out on walks, and really take care of our mental health, and our fitness is really, really critical. All
right, Robert Garcia, thank you very much for sharing your views. We appreciate it, and sorry about that audio problem at the beginning, but it was worth the wait. Nice to see you.